Good morning, everybody. It's Deborah Byrne from Deborah Byrne Psychology Services, and known across social media as DBpsychology. Now, this morning I'm going to talk about this week's blog, and that is about generalized anxiety disorder. Now, unlike what would be normal anxiety or fears and worries, generalized anxiety disorder tends to be an excess or an out of proportion type of anxiety and fears and worries. So it's perfectly normal to have some anxiety. It's perfectly normal to have some fears, some worries in your life on a daily basis. But when they become excessive, that's when it becomes a problem. So I'm not going to go into the symptoms this morning. My focus this morning is actually on helping yourself. So the symptoms and diagnosis you will find in the blog, which you can find at www.deborahbyrnepsychologyservices.com. In terms of treatment, very basically, it's a combination of things that usually works. CBT, cognitive behavioral therapy, talking therapy or psychotherapy as it's known. You also use medication sometimes if it's necessary for anxiety. And then also you've got to think about helping yourself. So that's what I'm going to talk about this morning. Now, in helping yourself, the first thing I would say to you is, if you realize that your anxiety levels are very bad, if you have excessive worries and fears, then my first piece of advice to you is go see your GP. That should be your first port of call. They can refer you on to somebody like me, a psychologist, or to a counsellor. If it's part of other conditions, because anxiety, this condition could also be attached to something like depression. It can also be attached to PTSD, postnatal depression, a whole range of things could be a problem. And part of that would be generalized anxiety disorder. So basically you have to have a tailored program for you. Always make sure that your therapist and your GP and anybody else that you have to see, any other specialist you have to see, are working together and that they are tailoring the program to suit you. Now, in saying that, there are things that you can actually do to help yourself. So first off, you go see your GP and you reach out and get help. The next thing I would suggest you do is you ask for support from your family and friends. Now, you want really good friends and really good family here. You don't want people who are putting it all on themselves and making it about themselves. This is about you and supporting you. So reach out and do ask. Even having one close friend that will help you and support during this time. That you get basic self-care right. So you have one good friend, GP, and the basics of self-care right. Now, I have a load of blogs at this stage up there all about basic self-care and looking after yourself, and it brings it right down, and the basics. I've always said basic self-care is the foundation of the house known as you. Okay, if your foundations aren't right, the rest of it just will not work out for you. Okay, so do check them out. The next thing I would say to you is get a support group. That support group can be online or it can be in person locally. And why I say that is, it's all well and good having a supportive friend or a family member, but you also need to be hearing other people who have a similar condition to you. You need that level of empathy and support. So I would also reach out to a support group, even if it is online. And there's a lot of them out there. Usually there'll be a national organisation and there'll be a support group either locally or online attached to it. So do check that out. Of course, as I said, treatment does involve CBT, talking therapy, So you need a counsellor. So you need to be reaching out. If you're not referred on by your GP, you can always refer yourself on privately to a psychologist or to a counsellor. Please check out their qualifications. Make sure that they are properly qualified and that they deal with your condition. In this case, it would be anxiety. But if you have a combination of other conditions, make sure they deal with those too, because you want that tailored program. The next thing I would say to you is, and we're going to get down to really basics here, it would be to reduce your stress levels. Again, I have a great blog on how to reduce your stress and some tips I give you on how to reduce your stress. And setting healthy boundaries. If you're not setting healthy boundaries, perhaps your anxiety is caught up in that. So you need to look at, what you're doing and how you're interacting with other people. So sometimes we have to cut people out of our lives or cut people off for a time until we recenter ourselves and have the treatment that we need, and learn to set healthy boundaries and be assertive. A lot of the times when we have anxiety, we aren't assertive. So learning to be assertive and set those healthy boundaries is very important. And that is something you can do for yourself. Your trust levels in yourself is also going to be reduced. They're going to take a bashing. Basically, your self-confidence is going to take a bashing. So think about that. So think about rebuilding the trust in yourself. Again, I have a great blog and I think I did a video on it, on building trust in yourself again. So check that out. I'm giving you all the tips. There's a lot of individual small tips that you can do on setting healthy boundaries, on building trust, on reducing your stress. So it's going to take time. So take that time. This is now your body telling you need to take time for you. So just take it one step at a time. And by doing that, by one step at a time, I mean start with the basics, start with the basics of self-care. So that could include, and very important with anxiety would be to reduce caffeine, reduce alcohol, and maybe take up some form of exercise, even a gentle walk. Maybe go for a walk for 10 minutes and then do that a couple of times a day or 3 times a day would be so beneficial if you have anxiety. Of course, it's beneficial to any part of your mental health. The next thing, a small thing you can do also, is to use a diary. Now, if you are able to continue working, or you have your own business, then setting no more than 3 top priorities to get done that day. Remember, you're trying to reduce your stress levels, and even if you aren't working, you've had to stop work because of this, you need to only have 3 priorities maximum in the day. So that could be to do with your exercise. It could be something you're working on to reduce your stress level. It could be something to do with, maybe you have to remind yourself to eat 3 times a day, because sometimes people will overeat and sometimes people will not eat enough. So if you're in the category that you need to rebalance your diet, either way, maybe eating 3 meals a day and 3 healthy meals a day is what is a top priority for you that day. But always think about it, no more than 3 3 top priorities in any day, and keep it in a diary. It's kind of a checklist to tick off and say, okay, I've done it. I've actually done that. I've achieved that. It's something to focus on. The next thing I would also say is keep a journal. Now, the journal should be separate from the diary. I think some people were getting confused about that when I've talked about it before. So a journal should be separate. A journal is like a brain dump. It's not Dear Diary. Okay, this is just a brain dump where you get, at the end of the day, you get all those emotions out, all those thoughts out, all those feelings out, everything down on paper, and it gives your brain a chance to have a rest. It will reduce your anxiety when you do that. I would also use a word that would be used in around the halls of Al-Anon or AA or GA or any of those associations. They're wonderful organizations, but it's a word called HALT. And it basically, you put it up, HALT, big letters, put it up on a piece of paper wherever you can see it. Stick it on your phone as a screensaver, whatever you can do to see this word. Basically, it means if you're hungry, if you're angry, if you're lonely, or if you're tired, stop doing and take care of yourself. So it's just a reminder, a word to remind yourself, if any of those things are happening to you, if you're feeling hungry, feeling angry, feeling lonely, or feeling tired, it's time to stop and look after yourself. It's a great word to remember. So if you can put that up around the place, where you're going to see it during the day, on any of your tablets or your laptop or your phone, or even just on little sticky notes on the bathroom mirror, or in the bedroom, or somewhere where you're going to see, on the fridge, somewhere you're going to see it. It's a good reminder to stop and look after yourself. Sleep is very important, and I have a blog up there about sleep and how you can help yourself. Make adjustments if you need to, and if you're having problems with sleep, please go and see your GP, because your melatonin levels could be off. So I would very, very much recommend, if after reading my blog on sleep, and you've done everything, and you can put your hand on your heart and say, okay, I've done everything I can, go and see your GP. You may need a short-term medication, or you may need medication called for your melatonin, and you can get that. It's about a month's worth of melatonin, and it's very effective. It really is very effective at helping you sort out your sleep problems, because there is nothing worse than having a sleep problem and not, you can't cope. You really can't. If your sleep is disturbed, ask any parent of a newborn baby. If your sleep is disturbed, nothing works. So do check that out. Do check out the blog on sleep, and do check out, going to your GP if you feel that is necessary. Now, a few more things to finish up. Hobbies. If you can take up a hobby, it is brilliant to help your anxiety, because it deflects you away from what's going on in your head. Your concentration goes to the hobby rather than everything, the washing machine, and all those anxieties and all those fears and all those worries that are going on washing machine full spin mode in your head. It distracts you. So think about taking up hobbies that are going to, take your concentration away from what you're thinking about right at this moment, that you can step into, just like exercise. You can step into it, head out for a walk because your head is on full washing machine mode, if that's possible, and think about taking up that hobby. The other thing is also recommended for generalized anxiety disorder is alternative therapies. So we're talking about acupuncture, Reiki, reflexology, anything like that. Have a look at a massage, even anything like that, are brilliant for helping anxiety. So look into alternative therapies as well as, and I give a whole list of them in the blog this week. So have a look at those, as well as your counselling, and your if you need medication as well. Now, my final thing is, there is a wonderful book by a lady called Caroline Cunningham, and it's called The 7 C's of Calm. I have a link in the blog out to it. It is a book and a workbook, and it is all about helping yourself if you have anxiety. Caroline herself had anxiety, and she wrote about it, her own experiences, and she wrote a workbook to go with it. So it's a self-help book, and I've read the book. I've gone through the steps in the workbook, and I think it's an excellent book if you can pick it up. It's not that expensive. I believe it's available on Amazon, and also it would be available, I think, in Eason's, but you can check it out. I have a link to it anyway in the blog, so do check that out. So I'm going to leave it there. Just remember, take care of yourself. Start with the basics. Go see your GP, and start with your basics. Go back to basic self-care. That means looking after yourself, and that isn't a selfish word. Looking after yourself isn't a selfish word. Remember, you cannot look after anybody else if you haven't looked after yourself first. And I will leave it at that this morning, and thank you all very much for tuning in. And I will talk to you all again next week. Goodbye.